Alright, for this video we're going to talk about controlled substances and basically with an Alabama bias. So probably if you were listening to the last ones you heard me throw in Alabama references, but this is going to make sure more complete. So we're going to start with Article 3. Well, Title 20, Article 3. So Title 20 is controlled substance for Alabama. It's administered by the admin of it is the State Board of Health. They add, delete, and reschedule drugs per Alabama. The current list is maintained by the State Board of Health and it's available on the website and updated annually. So let's start with the regulation, manufacturing, and distribution of controlled substances. There is a special registration above normal registration for research for Schedule I drugs. Before denying, suspending, or revoking a registration, the applicant served an order to show cause. There's a notification of time, date, and place in hearing in a minimum of 30 days from the hearing. There's the administrative hearing, and then you can appeal to the Circuit Court of Montgomery County. So moving over from there, Schedule II stimulant drugs can only be prescribed for therapeutic treatment of narcolepsy, ADHD, hyperkinesis, brain dysfunction, epilepsy, differential psychiatric depression in only 30 days, clinically significant depression in only 30 days. So suspension without prior order to show cause. If you have an intimate danger to public health or safety, they can do it through your license. And let's see, for an emergency situation for Schedule IIs, residents of a long-term care facility, patient receiving hospice, or patient receiving home health care. Typically, it's general population, but not in Alabama. So in Alabama, you can only be one of those. You can't do a emergency refill or emergency fill of a Schedule II. I take it orally for the general population in Alabama. But you can only give an adequate amount to cover the period, not to exceed 72 hours, and the practitioner shall provide a written prescription for the quantity prescribed within 7 days. And from my understanding, if they give you the written prescription and it's for more, you only have 72 hours to give them the partial filling of that, the rest of that filling. So next is Article 3A, the Qualified Alabama Controlled Substance Certification and Registration. This is what mid-level practitioners need. It's a minimum of 12 months of active clinical employment, work under supervision of a pharmacist, and submit proof of successful completion of approved courses. So prescriptive authority of a certified assistant to the physician, only C3, 4, and 5s in accordance with rules adopted by the board, and any protocol formularies, medicines established by the board regulation of a QA/CSC. So to prescribe Schedule IIs, they actually have to have that other permit that I'll discuss toward the end of this video. But they may not utilize their QA/CSC for purchasing, obtaining, maintaining, ordering any supply or inventory of controls. They shall not dispense, and they shall not prescribe any control to self, spouse, child, or parent. Let's see, moving on to Article 6, Therapeutic Research. Controlled Substance Therapeutic Research Programs shall be limited to cancer, chemotherapy patients, glaucoma patients who are certified to review committed by the authorized practitioner, and it's a felony if it's not for this case and it's prescribed. If you prescribe a controlled substance for research and it's not chemotherapy or glaucoma patients, that's a felony. Exempt from prosecution of cannabis, though. Article 9, precursor chemicals. So sale of ephedrine, Alabama Methamphetamine Act Abuse Task Force. So 30 milligrams or more ephedrine or pseudoephedrine have to be sold in blister packs. Products must be sold behind the counter, and video surveillance must be obtained for a minimum of 30 days or in a locked display case. Not more than 3.6 grams in 1 day, and 7.5 grams per individual within 30 days. That's state specific, and for federally it's 9, so for Alabama 7.5. The individual must be 18 years of older with a photo ID, an unsuspended driver license or non-driver license issued by the state, a U.S. Uniform Service ID card, or U.S. or foreign passport. Maintain log with name and address of purchaser, date and time of sale, name of product being sold, total quantity in grams of product being sold in your log, which can be electronic or manual. And I believe you only have one of each though. In Alabama, there's no smurfing, that's prohibited, of course. Now moving on to the Controlled Substance Prescription Database, PDMP, Article 10. So this advisory committee has one representative from each of the following. So medical, dental, pharmacy, veterinary associations, state health office, hospital associations, executive director of ALBOP and MedX, optometric association, representative from each of the certifying boards established under the Alabama Uniform Controlled Substance Act, independent drugstore association, and podiatry association. So all those that dispense controlled substance should report or shall report the name of the prescribing practitioner, date filled or dispense, name of person, full address of patient, name of person and full address of patient, the NDC number, the quantity, identifying designation of pharmacy or practitioner, and any other data that's pretty much required. Payment method and third party payer ID is also required. So there's limited access to the PDMP. It's to certified boards, licensed practitioners. There's no obligation to access it before you prescribe, but obviously it's very helpful. Licensed pharmacist approved by the department. It's limited to patient or prescriber. There's no obligation. Say state and local law enforcement can access it, but it's not public record. So ALBOP regulations for controlled substance. We're on 680 for Alabama. There's an annual controlled substance registration required, of course. So every pharmacist and pharmacy that does any of the following with controls, manufactures, distributes, or dispenses, an annual controlled substance registration is required. So you should probably already paid for that if you're about to take your MPJE. So payment is renewed on even years, delinquent after December 31st, due October 1st. Record keeping for your manufacturers, wholesale, and distributors. Unusual volumes should be reported to ALBOP within 30 days. Regarding surrender of license and permits or termination of operation, you must surrender within 10 days of termination. Provide inventory on hand at termination of operation within 10 days. Or your next of kin has 30 days to comply with the rules. In the report of theft or loss of controlled substance, so 106 must be done in 24 hours, and you do 4 copies of DA Form 106, which is DA gets original plus a copy, ALBOP gets a copy, and you keep 1 copy for your records. There is an annual inventory of controlled substances, January 15th of each year. Document whether it was opening or closing, the date, the signature, and the person inventorying. C2s, of course, an exact count. If it's over 1,000 with C345, you need an exact count. Pharmacists hired post-inventory date should take stock of controlled substances. As for invoices and acquisitions of controlled substances, invoices are reviewed, approved, and signed by the pharmacist. So moving on, kind of a summary now. Your QA SCS, and this is a lot of this from the FAQ. Do check out my ALBOP FAQ video. There's several videos, like 5, but there's a summary and that has really good stuff on it. So the QA CSC, proof of completion of course requirements, 8 credits of prescribing controlled drugs, 4 credits advanced pharmacology, and 4 credits prescribing of controlled substance, over or equal to 12 months of active clinical practice, and you submit forms to the medical board and the DEA. So this gives the prescribing protocol C3, C4, and C5 to the PAs, nursing practitioners, and certified nursing midwives of Alabama. If they're prescribing the initial prescription, it's limited to a 30-day supply. A reissue of the prescription must be authorized by a supervising, collaborating, or covering physician. If the prescription was originally prescribed by a physician and patient is well maintained, these mid-level practitioners are limited to a 30-day supply with 2 refills, so a total of a 90-day supply. Must be written or verbal when they're calling in, and you may sign for a C3 to 5 samples for office use formulary. Now there's a limited purpose Schedule 2 permit from the Alabama Board of Medical Examiners. It gives prescribing protocols for C2s. So long-acting C2s must be initiated and dose increased by physicians. These mid-levels can write maintenance doses only, and only prescribe in hospice, palliative care, nursing home, rehab facility, or oncology. If prescribing initial prescription for a short-acting C2 or any narcotic C2, it's limited to a 30-day supply, and the reissue must be done by a physician after the physician sees the patient. If it's a narcotic C2 prescription was originally prescribed by a physician, the A limited purpose Schedule II permit holder may reissue one 30-day supply. If non-narcotic C2 prescription was originally prescribed by a physician, the LPSP holder may authorize no more than a 30-day supply with 2 reissues. So very similar to the other rules, but you need the LPSP to do it. Dose escalations, of course, must be done by a physician. Drug must be for specific patient use off premises, not on site. Supervising physician audits via Alabama Department of Public Health, PDMPs, at least quarterly. So prescriptive authority in Alabama, MDs, physicians, which is your MDs, your DOs, Doctor of Osteopathy, dentists, DDS, DMS, podiatrists, PDM, and veterinarians, DVM, can prescribe C2s. They can both have all controls and all legends within their scope. Optometrists, ODs, can only do C3, 4, and 5. They cannot do C2s, and they cannot get the permit to do it. The optometrist. It's an OD. So DOs can, ODs cannot do C2. The PAs, NPs, or CRNPs, and the CNMs, midwives, can do C3 through 5 with the Q, A, C, SC, and they can do C2s with the LPSP. So prescribing weight loss meds only in ND or DO. Our mid-levels can only do Belvic or Q-Smile, which are prescriptions only. You cannot do they cannot do the generics. Must be written or e-scribed. Max 35-day supply for the first fill, and then after the 35 fill, they have to see the patient, and if they have reached their goals, they can do another for the normal 6 months from written date or 5 refills, and that's Belvic and Q-Smile only. Other than that, the MD or the DO has to write for the weight loss medication, and you cannot do stimulants for weight loss, not an MD or DO. So, drug expiration, there's no expiration for Legend, C2s, or C5s. 6 months after written date or 5 refills for C3 and 4, and the stock expiration is 1 year from the day that it was prescribed. So, a vial wrap, they would have the caution for law prohibits dispensing without a prescription. Alabama Board of Medical Examiners ask pharmacists to contact them if anyone treats their family or their self or their immediate family, physicians wise. The exception is if there's an emergency or an isolated setting, but you should still contact the Alabama Board of Medical Examiners if this happens. And I think that's it. CBD with no more than 3% THC is legal in Alabama now and can be sold at pharmacies. Alright, that's it for the controlled substance overview. I'm going to do a DEA video and talk about some non-prescription drugs.